from the station that's on your side. This is a Channel 7 News Town Hall special. Helping our heroes.
Well, hello and welcome to this KATV Town Hall event. I'm Chris May. We join you today as we observe Veterans Day in this country, a day we set aside to honor the men and women who have served in the United States Armed Forces. It's a day to salute their valor and to thank them for their sacrifice. But it is important to remember that the lives of veterans extend well beyond that one day. They live lives with unique challenges and needs, challenges that ordinary civilians can never fully understand. And it's for those reasons that President Lincoln made a promise in 1865 to, quote, care for him who shall have borne the battle and for his widow and his orphan. Today, during our program, we plan to explore how our country and our state are keeping that promise to our veterans. Joining us here in our studio today are three people who have made caring for veterans their life's work. Gina Chandler is the Director of Veterans Services for the Arkansas Department of Veterans Affairs. Laura Watlington is the Suicide Prevention Program Manager for the Central Arkansas Veterans Healthcare System. And Dr. Ivy McGee Blanks on the end here is a physician with the Central Arkansas Veterans Healthcare System as well. We thank you all so much for being here today.
Thank you.
You know, we want to cover a lot of ground today, but I want to ask you first to help us understand the challenges that our military men and women face when their service comes to an end, when they first become veterans and they make that move from a highly structured, purpose-driven lifestyle back into civilian life. What is that adjustment like? Gina, as a veteran, do you want to start with that?
I'll take that one. Yes, as a transitioning is hard. You know, you're told in the military when to wake up, when to eat, how to do things. So transitioning into that unstructured life can be hard for one. Seeking employment, what is my next role? A lot of veterans often are continually serving. That's what I do in my job, is we serve other veterans and find a way to give back. So navigating the transition process can be hard, but there are resources out there for veterans, such as our Department of Veterans Affairs, to help veterans connect with the federal VA, to connect with jobs, to connect with the community, basically. And we want our veterans to stay here in Arkansas.
I imagine it's a challenge, Lord, just reestablishing maybe a sense of identity and a sense of purpose after you've been wrapped up in military service for as long as many people have.
And actually, I'm not a veteran, but I've worked with veterans for a number of years, and that's one of the biggest things, is that not only do they have the structure of the military life, that purpose and mission that they're out there filling every day, when they come home, they're lacking that purpose and mission. And so we have a lot of veterans that create their own organizations. ADVA is able to guide them in those directions. VA, we are able to offer a lot of programming. We have a volunteer department that could help serve for fulfilling that mission that people continue to need. They really need that. So, yeah.
There's also the process of reconnecting with a family and reestablishing your role in that family, or for some younger veterans, even just establishing that role in the first place. Dr. McGee Blanks, do you want to talk about that?
Yes, I certainly can. When they make the transition back home, there's some changes that they've got to get used to, because people have gotten used to operating in the family without their presence. And so now it's a time to reintegrate and to reconnect. And so in those cases, not only do our mental health and our primary care providers support that veteran, but also they want their caregivers to be a part of the treatment plan for them, so that they can have that integration and that support that they need.
Many veterans, I know too, struggle to find work when they get out of the service. Many join right out of high school, and so maybe they lack some of the educational requirements that some jobs have today. How significant a problem is that, and what kind of resources are available to help those veterans?
So during your transit, they have a transition program, or the TAP program, that the Department of Defense offers, and helping them write resumes, helping them look for jobs. But really, it's finding my footing. Am I going back home? Am I staying where I'm getting out? You know, where am I going, and what am I going to do after? And really, they start the transition process a year out before they even start to leave the service. So they're looking for jobs, high-paying jobs, because what we find is their skills that they learn in the service are not easily translated into, I can be a professional this or a professional that. So it's trying to untangle the years of leadership experience that they do have under their belt and translate that to English, so to speak.
Right. Well, and you mentioned that they are natural leaders. They're self-starters. They're motivated. It seems like opportunity is just the issue there.
There's also the GI Bill. I'm not a federal benefits person. I'm a federal healthcare person, but they have the GI Bill where, you know, their service then gives them money to go to college. There's also on the benefit side and the healthcare side vocational rehab programs that teach them how to utilize the skills that they learned while in service and apply those to, you know, more civilian life type jobs. So VA tries its best to help get them reintegrated before they leave duty and then once they are out.
Correct. And really just connecting with whatever state department you're going to be. So Arkansas Department of Veterans Affairs, there's a state department in every state that has all the resources, connects with the federal VA, knows what's local in their community. We work with Department of Workforce Services, you know, to make sure that we have the talent and available to get them high-paying jobs.
And the healthcare workers, sir, also know that they can help their veteran with consults to different services. They can get social work and vocational rehab services to them pretty quickly, and just make sure that they are educated on every benefit that's available to them.
Yeah, and there's so many, we know. Another adjustment veterans have to make after ending their service is providing basic necessities, either for a family or for themselves. Things like food and clothing and housing, things that have been provided by the military. Now someone has to go out and they're responsible for that themselves. I imagine that for some, including younger people, that can be overwhelming right at first.
Absolutely. I grew up in the military and then I joined the military. I never had to worry about not turning lights off. I mean, you would think that, and now you have to pay for electricity. So we're turning all the lights off in the house. So, you know, being able to navigate outside the military, you know, there are resources on the state side that we can connect veterans with food insecurities. We have a child welfare program that provides grants to veterans if they can't pay their rent or utilities or whatever the need is. We have money set aside at the state to help veterans with that.
You mentioned food insecurity. I saw a statistic that about 27% of Afghanistan and Iraq war veterans experience food insecurity, and that rate is more than double that of the general U.S. population. What can we do to change that?
We're actually working with some programs coming soon. We're in development with Senator Bozeman's office to try to see how we can get the resources out to our rural veterans and find out where our deserts are, the food insecurity places are around the state. You know, we have a lot of nonprofits that want to help take care of that. We have, you know, food pantries, things along those lines, but it's getting it to the veteran, and the number one thing is for the veteran to ask for help. Veterans will not ask for help. And so it's a neighbor, it's a family member seeing that they are suffering and getting them to the resources. When they come to the Arkansas Department of Veterans Affairs, they typically will open up and say, you know, I can't pay my bill, we're struggling here. And we're here to uplift them, because you take that one thing off their plate and the dynamic changes.
Right.
Oh, no, I was just going to say, we get calls to the Veteran Crisis Line, the 988 press 1. We get calls from veterans who feel safe enough in that kind of anonymous way to say, I need help. And it could be things such as, I need help with food. Well, it's a crisis line. You know, not having food or not being able to provide for your family can create those kind of crisis conditions, which can lead to serious issues up to and including suicidal thoughts. And so, you know, while VA doesn't have like a food program that we're sending out food to veterans, we utilize local resources wherever they are. We also try to have outreach events where veterans can come to us and see us in person in their areas, and we can rely on the local resources that are available to them.
I do want to talk to you about the crisis line a little bit later on, but Doctor, one study found that 86% of veterans were overweight when they first visited a VA clinician, and another found the rate of diabetes 5% higher among veterans than the general population. Both of those facts can be traced back to food insecurity. Do you see a lot of that in your office?
Absolutely, I did when I was just a primary care physician only, and we would partner, primary care would partner with Whole Health, and that's a department that helps with teaching about diet, about gardening, about food preparation. We also would partner with our social workers, with our civic engagement, and with our volunteer services, because these are our partners that help us to reach out to Arkansas Food Bank, to Meals on Wheels, to just make sure that we have those services available. But what we try to do in our primary care, visits, we would try to educate not only that veteran but their family member, and try to teach them a better way, a more healthy way of living and eating. But the food deserts that are in our communities, those really truly are a problem that we have not really navigated well, and so it's going to take state and federal partnership to fix that gap.
Yeah, not just for veterans, but for our entire communities
Yes.
as well. Okay, ladies, we're going to have much more from you in just a moment, but you know, there are so many other challenges facing our veterans, from a growing mental health crisis to physical disabilities. We'll talk about them and pose questions from veterans to our panel in just a moment. But first, let's take a closer look at the federal agency that is charged with serving all who served, and that is the Department of Veterans Affairs. Few have been more closely involved with the oversight of the VA than Arkansas Senior Senator John Bozeman. The son of an Air Force veteran, he's an outspoken member of the Committee on Veterans Affairs. I had a chance to speak with Senator Bozeman about the state of the VA and how it can better serve its clients. Here's our conversation from earlier in the week. Well, Senator, thanks so much for being with us today and talking about this important topic. We certainly appreciate your time.
No, thank you so much for having me. Talking about, as you say, a very, very important topic.
Indeed. You have said in the past that our nation has a responsibility to honor our promise to those who selflessly place themselves in harm's way to protect our nation and our ideals. As a senior member of the Veterans Affairs Committee, how would you rate the performance of the United States government generally and the VA in particular in fulfilling that promise?
Yeah, in the last several years, I would give us an A+. The reason I say that is last Congress, again, working hard this Congress, the last several Congresses, we passed sweeping legislation. The PACT Act, which we passed in the last Congress, which had to do with people being exposed to burn pits, various chemicals, giving them the benefits that they'd earned regarding that, taking care of these individuals. That probably was the biggest bill that's been passed in the last 30 years regarding veterans. So the good news is this is a very, very bipartisan effort. We hear about all the rancor going on in Washington. This isn't about Democrats and Republicans. This is about taking care of veterans. And both sides working together, I think, are doing a good job of doing that. We need to do better, but like I say, we're doing a good job right now.
The agency conducts a survey each year called the VA Trust Report, and this year found that about 79% of veterans trust the VA. And I know that anyone in your line of work or in mine would love to have that kind of approval. But I do wonder about the 21% who did not answer in the affirmative. Why do you think they might lack trust in the VA, and what can be done to change that?
I think there's a number of different reasons. Maybe they had a friend that had a bad experience, and so they don't want to go. We've also made it much easier to get community care, so people are looking, towards that. What we've done, though, is to try and capture those people. And so we're giving grants to agencies within the communities that maybe do a good job regarding suicide, mental health, those kind of issues. So working with agencies that are trusted, doing a good job there, and then trying to get them in the VA, because in the VA you've got a lot more benefit potential. So it's just a matter of working together. We're constantly trying to figure out, as you say, how we can capture that percentage and getting them in a good place with the VA, and then also making sure that the VA is not, in some cases, doing something inappropriate.
Some of the top concerns that were mentioned in that VA Trust Report mirror some of the complaints that we will hear in our newsroom from time to time from veterans. They have phone system issues, or they have appointments that get canceled, or they're turned down for benefits that they are sure that they're entitled to. I know that each case is unique, but what would you say to veterans who feel as though the system doesn't necessarily work for them?
Well, be sure to contact us, contact the people that represent you. They do a good job interfacing with the VA. We'll be glad to follow up on those issues. Benefits are certainly a concern. What we will do is make sure, and the veteran service organizations do a good job of this, of making sure that they get whatever they're entitled to regarding other people looking at it to make sure that the decision was a good one. So no, we're quite willing to track those things down and make sure that the veterans are getting what they're entitled to, that we work so hard to, we work hard to get these benefits passed. We want to get those done in a timely fashion. They're like everybody else in healthcare though, and I think this is important to remember. If you go to get an appointment now, you're probably going to have to wait a long time to see your doctor. If you see your doctor, your family practitioner, and then you need to see a specialist, in regular health care, you're going to wait a long time to see that specialist. In the VA, they've got the same problems, maybe even more so, because one of the problems they've had is that they haven't kept up regarding the pay schedule, things like that. So myself and some of my friends on the other side have introduced legislation to get us in a better position, to make us more competitive, so that we can make sure and get the information that we need as we go forward to give them, to make them more competitive.
The veterans care in the U.S. is shattering records right now, due in large part to the enactment of the PACT Act, which you mentioned earlier. 116 million healthcare appointments were made this past fiscal year. 2.4 million claims were submitted. And we know that those numbers are only going to get bigger with each passing year. What do you think the VA will need going forward, either in terms of money or in personnel or in modernization, in order to continue to meet the kind of demand that's out there?
No, I think that's really a good question. We work hard. We pass legislation giving benefits. We want to make sure that the VA has the personnel to administer those. And so they're going to need more resources. There's no ifs, ands, or buts. I actually I'm the ranking member, the head Republican on appropriations that controls their budget. So we meet with them constantly. The good news is what they've asked for, we've delivered. And we're committed to doing that. In fact, we just passed the appropriations part of that in the Senate the other day. So there's tremendous support on both sides, Republicans and Democrats, making sure that we provide the resources, the funding that they need to do this. On the other hand, what we're running into is just like whether it's at the station, or whether it's the Waffle House or whatever, personnel are hard to find. It's labor is a huge issue. And so they're experiencing the same problems. As I said earlier, we want to make sure that we make them competitive as they compete with the private sector regarding jobs. But labor is a huge issue, and they're finding the same thing. The other problem that the VA has is they've got all these rules and regulations. Somebody might want to come to work for the VA, and it might take them 8 or 9 months to get them on board. Nobody's got that kind of time to wait. So we're working to help them make the bureaucracy less burdensome to get the people on board that they're going to need, not only now, but in the future.
That's our conversation from earlier this week with Arkansas Senator John Boozman. We're back in our studio now with our panel from the Central Arkansas Veterans Healthcare System, Dr. Ivy McGee Blanks on the end, Laura Watlington, who is the Suicide Prevention Program Manager, and Gina Chandler, the Director of Veterans Services for the Arkansas Department of Veterans Affairs. Senator Boozman has done so much work for Veterans Affairs.
Absolutely. I mean, when he comes home to Arkansas, he tours the states, he talks to veterans. As a matter of fact, the PACT Act was inspired by Vietnam veterans and Gulf War veterans that spoke to him directly and said, we're suffering and something needs to be done, and he stepped up.
Okay, we're going to talk about the PACT Act in just a few moments, but Doctor, first I want to ask you, or Senator Boozman rather said that, quote, VA healthcare is moving in the right direction. Mm-hmm. As someone who's on the front lines of that effort,
yes.
Do you agree with that assessment?
Absolutely, and on behalf of our executive leadership team and our healthcare workers and our frontline staff, I want to thank the 77,000 veterans who've chosen us who've chosen CAVHS for their health care. And we want to thank Senator Bozeman and his staff for all that they do, the support that they've given to VA and the veterans across the state.
Well, we've always heard stories when it comes to VA healthcare of long waits and long lines. Is that still the reality, or has that changed?
That has changed dramatically, as a matter of fact. We've recruited and retained enough staff, and we have enough state-of-the-art technology and research capabilities that we are able to see veterans within, most of the time, 20 days within them making a call to get an appointment. If it's someone that is already an established patient, it may take a little bit longer for a new patient wait time, but everything has improved dramatically.
To your point, veterans have rated Veterans Affairs hospitals higher than private healthcare facilities in all 10 categories of patient satisfaction. Some might find that surprising. Do any of you?
Absolutely not.
No, not anymore.
Yeah.
When I first started, there were the horror stories, there were the wait times, but VA, and under the leadership of Secretary McDonough, has stepped up and truly put the focus on veterans, and so the wait times are gone away. There's care in the community now, so there's options for veterans, and the best place for veterans to get their health care is through the VA.
8.8 million patients enrolled in VA care, 26 million clinical encounters in this past fiscal year. 79% of veterans say they trust in the VA, 90% trust in VA healthcare. So clearly you're doing something right.
Yes, sir. We're definitely trying to. We're reaching out. We've got a lot of community outreach programs. We travel. We've got a special operations team that travels across the state to various events so that they are able to let veterans who are not enrolled in our healthcare system know that we're there, we're available, and we want to be a part of their healthcare journey.
Laura, I know an important part of veterans' health care is the treatment of conditions like depression, anxiety,
Yes.
Post-traumatic stress disorder, and substance abuse disorders. 62% of combat veterans who served in Iraq and Afghanistan said that they knew someone who was killed on duty. I know that they carry those scars home and for a long time.
They do.
Talk about
they
that.
carry that survivor's guilt that they came home and their brother didn't, or their sister in arms, and so that can cause long-term damage to one's mental health and their psyche. VA offers a wide array of programs with evidence-based treatment to help veterans. I think VA is especially equipped to help veterans who are having these kind of issues because we have trained staff. We have a lot of staff who are veterans themselves that can relate, because they say, as a non-veteran, I'm not going to relate as well as a veteran. So we have programs that are inpatient, we have outpatient, we've got 8 community CBOCs throughout the state that we can serve our veterans. With the whole state is covered, but it's a real burden on our veterans who come home with that.
And I would also talk about that, all veterans, no matter your discharge, can make that call to receive mental health help through the VA. Everybody thinks you have to be honorably discharged to get mental health help. That's not true. As of 2017, they can get help through the federal VA.
And you mentioned a phone call. What's the number to call?
The number to call is 988, and we would like you to press 1. It's the same number that has always been, the 1-800-273-8255. That number's not going away, but 988 is a simpler, easier number to call. And family members can call as well.
Okay, important to remember. One study found that 30,000 service members and veterans of post-9/11 wars have died by suicide, and that the highest rates of suicide are among the 18 to 34 age group. This is an issue that is particularly acute among our youngest veterans, correct?
Yes, absolutely it is. We, as the Suicide Prevention Program, we do outreach as much as possible to get the word out there about what is the crisis line. We recommend people call the crisis line before they're in crisis, because if we can prevent them from getting to a point of crisis, then we've gone a long way. And so we really want people to call and reach out. We really try to embrace communities. I've got a couple people that are focused on 100% coalition building, because our veterans who live in Mena may not want to drive to Little Rock for an event. So we've got people down there in Mena who are creating coalitions and getting veteran buy-in and creating the brotherhood that they miss from being in the active duty. And so,
and a lot of that too was National Guard. I mean, National Guard was called up to go serve and fight the war, come back, and they go to their communities. So they're not on an active duty base. They will drill on their weekends, and weeks out of the year. So it was looking at how it affected National Guard, and that's where you're seeing the 18 plus committing suicide.
And they should not be forgotten. The suicide hotline, in fact, did receive more than 88,000 calls, texts, and chats in the month of March, which was their highest ever. So people are taking advantage of the opportunity.
Absolutely.
To reach out
And
for help.
with the launch of 988, our call volume significantly increased.
I will say one lieutenant colonel said that he described it as being on the front end of a mental health tsunami. That's a big challenge.
It is. And how we're trying to overcome that challenge, we are educating our clinicians, our nurses, our dentists, pharmacists, and all of our healthcare providers to ask those questions. It doesn't matter if you come in for a cough, cold, or whatever it is that you're coming in for, whether it's an acute issue or a chronic issue. We're going to bring up suicide prevention screening questions during our interaction so that you're not going to walk away saying, oh, I wish I had talked to that person, or I should have talked to that person. You're going to bring up those questions in a very comfortable way so that they can feel safe to share that information with you. And then we do warm handoffs to our behavioral health professionals that are right there in the building if we feel that that's necessary right on that same visit.
Right. I know that mental health challenges can also contribute to homelessness among veterans. One study found 30% of all homeless people are veterans, which I found to be stunning. How involved is the VA in combating the crisis of homelessness among veterans?
VA has a huge homeless program. We've got the Day Treatment Center that's downtown Little Rock, and they've got huge staff. They got outreach. They go to known homeless camps to identify veterans who are living out there in those camps. But they also have, their doors are open every single day for a veteran who's homeless to come in to receive food, shower, they can do laundry, they can receive group therapy, and they also have programming to get these veterans into housing. And so VA has a strong program really helping with the veterans.
Okay, so in addition to the emotional and psychological scars, we know that a lot of veterans also return home with physical scars of service. Doctor, things like amputations, disfigurement, what kind of services are out there and available to those veterans?
So we have prosthetics that's going to help to supply those types of appliances that you may need, some type of whether it be wheelchair or you need some type of limb customized for you. We have physical therapy, occupational therapy services that we provide each and every day. And that's not just at the Little Rock and North Little Rock campuses, but also at those CBOCs. And those CBOCs are our community-based clinics that are in Conway, El Dorado, Mena, Mountain Home, Pine Bluff, Russellville, and Searcy. I believe I left out Hot Springs.
Okay, let's go over some questions now that have come into our newsroom, including some from veterans. Let's take this first one. If a veteran is not already enrolled in VA healthcare, what is the first step they should take to establish the relationship with VA?
They can place a call to 501-257-1000 or 501-257-5656. They'll be reaching an enrollment or eligibility specialist with the Central Business Office in order to get their eligibility reviewed.
And one important document is to have your DD-214. That is a requirement to prove your service and get you enrolled. So that's an important step too.
DD-213.
DD-214.
214.
Our
Okay.
discharge papers.
There you
Yes.
go. Any veteran would know, right? The VA has been encouraging veterans, as we mentioned, who suffered toxic exposure to file a claim for benefits under a new law called the PACT Act. It's the biggest expansion of benefits in generations. More than 500,000 claims have been filed since August of 2022, and more than $1 billion in earned benefits has already been paid out, which is amazing. The question on the PACT Act, we have a couple, in fact. First, do you have to be signed up with the Burn Pit Registry to qualify for benefits under the PACT Act, Gina?
And the question is no. The Burn Pit Registry is something separate, class action lawsuit, separate from the federal VA. So no, you do not have to be signed up. You have to have served in areas that are outlined in the PACT Act and have one of the disabilities on there in order to apply for service connection under the PACT Act.
Okay, another question. Will filing a claim under the PACT Act negatively affect a veteran already receiving disability benefits? I know this is a big one.
This is a big one. So this is where I say reach out to your Veteran Service Officer.
And how do you do that?
You do that at 501-683-2382. That is the Arkansas Department of Veterans Affairs number. We have county service officers and district service officers and all over the state to help you with this. So does it negatively affect you? yes and no. Anytime you file a claim with the VA, no matter what your percentage is, the VA has the opportunity to look at what you're already service connected for and if there has been marked improvement. If there's marked improvement, the VA has a right to propose to reduce that benefit. And so that's where we kind of caution veterans. So we look at the whole package. What is the benefit versus risk when filing that claim? And we want to make sure that the potential outcomes. So that's why you have sitting down talking to somebody about this and saying, hey, this is what could happen if we do this. On the other hand, it's absolutely the best thing to do if you are a lower percentage and you can increase your overall percentage. And it could put you at the 100% because a lot of the veterans a lot of the disabilities under the PACT Act are cancers. And cancers rate at 100% initially, and then they dropped down to the residuals after 6 months. So there's money out there.
And if a benefit is ever reduced, there is an appeals process in place, but that can take a while.
It's a different appeals process. There's a process in place for proposals to reduce. If you're denied, there are processes under the Appeals Modernization Act that you can appeal a decision if you were denied, if you don't like the rating percentage, if you don't like the effective date. That, again, working with a service officer to help you through that process, because some are short as 6 months, some are as long as 3 years in the appeals process.
You mentioned cancer, but the next question was, what are the main benefits of filing a claim under the PACT Act?
The main benefits is to get, one, service connected so they can get treatment through the VA. That's number one. There is a compensation part of it, the monetary benefits. And also, if anything happens to you because of those benefits, your dependents are taken care of, and that's really crucial. A lot of times veterans or spouses don't realize there are ancillary benefits. If you're 100% permanent total, you have dependent education benefits for your dependents, state property tax free. I mean, there's a lot of benefits getting to 100%.
Okay, some additional and more general questions here. When is it too late after discharge to file for disability benefits? Is it ever too late?
It's never too late.
Never too late.
The rule of thumb is if you file within the first year of leaving active duty military, the VA has to go back to the first day you became a civilian. After that first year mark, then it goes to date of claim. So if you file the next month after you got out of your year's up, then it goes to the date you filed the claim. So you could potentially lose up to $30,000.
And veterans are informed of this as they're leaving the service?
Not necessarily.
Sometimes.
Sometimes. There also is benefits on delivery discharge that the VA does 6 months prior to a veteran getting out. They can start filing their claim with the VA so that it is ready when they become civilian or veteran status.
Okay. The VA assigns disability ratings based on the severity of a veteran's service-connected condition, and that rating determines how much disability compensation someone will receive. We got a question from a veteran asking, what is the appeals process for disability ratings?
So the appeals process is if you are not happy with the percentage you were assigned, you feel that it should have been higher, you can let the VA know through a service officer. This is where you're really going to want a service officer. It's like taking a lawyer into court and helping you fight with your battle with the VA. So the appeals process is, it can be as simple as asking for a higher level review for them to take another look, or it can be as daunting as going in front of the Board of Veterans Appeals, where you're in front of a law judge and you're arguing the case as to what the VA did wrong and why they didn't grant what they should have granted.
Okay. We have a question here about community care. Community care is a program that was developed to help with the backlog of appointments for veterans. But our veteran who asked this question says that now there is a backlog for community care. What is being done to fix it is the question.
So the backlog that occurred with community care, we actually had to blame COVID for this.
Okay.
And that was because we were not having direct face-to-face patient care. We continued to give care through video means, virtual means, and through telephone. But for those actual face-to-face visits, that's where that backlog occurred. So now we are in the catch-up phase. And as I alluded to earlier, we've recruited enough staff. We kind of offloaded and had retirements and resignations and things during the COVID period. But now that we've recruited additional staff, we're able to bring those veterans in, and so that backlog is significantly improved.
One other point to consider is that sometimes the care that they're requesting from VA isn't available in their community. And so, and sometimes the wait time in the community is just as long or longer than for VA. And so there's a lot of issues that go with community care, but it's a benefit that is offered.
Oh, you mentioned COVID. COVID was hard on everyone, but it had to be especially hard on the veterans community.
Absolutely.
Absolutely. It was hard on the benefit side because they were unable to do what are called compensation and pension exams in order to determine the rating decision. So that backlog, but they cleared through all that. They got all, and they honored all the effective dates. They processed through COVID after COVID, but VA never stopped working, and Arkansas Department of Veterans Affairs never stopped working during COVID.
That's correct.
Yeah,
That is
We were there.
correct.
One final question that we have to put up on our screen. This is about a question about resources for homebound veterans, and the question is, what resources are available for homebound veterans? For instance, when they just need someone to talk to.
Well, we actually have a new program that our facility adopted called Community Contact Corps. And it's a program that my program is co-facilitating with Veteran Services, Volunteer Services, which is now our Community Development and Community Engagement, CDCE. So we're able to pair a veteran, we go through some interview questions, and we can pair a veteran with a volunteer to have weekly phone calls or every other week, whatever works best for the veteran's request. There's also, we have home-based primary care.
Yes.
I'm not so sure if that's,
Yes.
we can bring their home care to them. And so that's another option. Calling the crisis line could potentially be an option, but that's probably not something that we're going to want to do ongoing. But we do have
Absolutely.
community contacts.
And
for
those
sure.
are for veterans that are enrolled in the healthcare, so that's why we want to encourage enrollment. But for those that aren't enrolled into VA healthcare, we have county veteran service officers that go to their homes to help do claims. They go to nursing homes. We have VFW service organizations, American Legion, that reach out to veterans and just say, how are you doing? Because especially coming into the holiday season, the loneliness can also increase the suicide risk.
A few more questions about minority veterans. The VA Trust Survey found just marginal differences among groups when it comes to trust in the VA. 82% among white veterans, 80% among African Americans, 79% among Hispanics and Latinos, Native Americans slightly lower at 73% trust. Veterans are diverse, that they have different needs, but that seems to reflect a really purposeful effort to serve everyone.
Yes.
Absolutely, especially in the one, I know we're doing ethnicity, but women veterans, they're
Yes.
often overlooked or they don't self-identify. There is a whole clinic for women veterans
Yes.
in the VA healthcare system. So it's like the one thing I tell my women veterans, honor your service, get enrolled, know about your benefits, and then pass it on to the next woman veteran.
The fastest growing groups of veterans right
Yes.
now are women. And I wanted to ask you about two groups of veterans who were once denied coverage in the past. Those who received a less than honorable discharge because of behavior that resulted from either PTSD or military sexual trauma. Are those people now eligible for benefits? Do any of you?
So I
familiar
do
with that?
know that they are working actually through branches of services to upgrade those discharges and like expunge the discharge as far as it being other than honorable because of PTSD that was not identified in service and maybe they drank or they had a DUI or substance abuse and they were kicked out for that reason. So that's more on the Department of Defense side, taking the initiative to do the upgrades for veterans under those circumstances. But still, come see us because I've helped veterans with an other than honorable discharge get care. So you get benefits through, basically they admit that what happened to them in service caused them to have a service-connected disability. They won't get compensation, but they will get care.
Okay.
VA will provide treatment to people who have suffered MST, even if they're not eligible for any other service. So if you have MST, come to the VA and please, we will treat you.
Military sexual trauma.
Military sexual trauma.
There's also a question about military members who were expelled because of their sexual orientation before the Pentagon changed its policy toward LGBTQ individuals serving. Are they now eligible for benefits?
That falls under the whole upgrading the discharge. And if they haven't, if it's going through a slow snail's pace with the Department of Defense, come see us. We have specialists that will help do the upgrade discharge and argue these cases for the department, because the Department of Defense is the one that grants the upgrade. And so once we can help them upgrade the discharge, because yes, they can receive health care in some instances, but they may not receive compensation, and they need that compensation. So if we can get that discharge upgraded for the certain incidences, then we can get them both sides of the house.
I know you mentioned, we'll wrap up, but family members of veterans, the VA maintains 135 cemeteries where Americans can bury a service member. What should families know about that process and that benefit that is available?
Having the DD-214, that's the number one. They can register, they can pre-register. We run the State Cemetery in North Little Rock, and we run another one in Bird Eye, Arkansas. And you can go and visit and sign a pre-eligibility to be buried there or anywhere. You're welcome to be buried in a national cemetery, a state cemetery. We're seeing a lot more cremations. We have niches, we have in-ground, but pre-register. That's going to save the family a lot of heartache and grief when they're grieving their veteran and trying to find the paperwork to get funeral honors and all those things. It saves time. So the best thing you could do for your family, pre-register.
Okay. Before we go, let me get from each one of you a contact point, a phone number, a website that you would recommend veterans visit.
Again, 501-257-1000 is our general number. For eligibility, 501-257-5656.
Laura?
I would recommend 988, press 1. If you request a consult, it'll come to myself and my team, and we will respond to you. Also, there's a great website called Don't Wait, Reach Out. That has a lot of really good resources to assist veterans who need to reach out to someone.
And the Arkansas Department of Veterans Affairs, you can reach us at 501-683-2382. Our website is www.veterans.arkansas.gov, and that will be up soon. It's in the process of maintenance.
Okay, bookmark it now. Dr. Ivy McGee Blanks, Laura Watlington, Gina Chandler, thank you all so much for walking us through all these issues and for all the hard work you do.
Thank you.
Thank you for having us.
We appreciate you all. That's going to do it for today's Town Hall on Veterans Affairs. Make sure to like this program and subscribe to the KATV YouTube channel for more quality content. And if you'd like to see my full unedited interview with Senator John Boozman, it's posted on our YouTube channel and at KATV.com. Our thanks to all of our guests and to you for watching, and a special thanks to all the men and women who have given so much of themselves for this country. We salute you. Until next time, I'm Chris May.
Hi everyone, I'm Cassandra Webb. Thanks for checking out the KATV YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click the subscribe button and don't forget to download the KATV News app for breaking news alerts. Thanks for watching.